Hey YouTube, it's me Sean. I'm doing this video again because I just got cut off. So, so I'm going to do my initial reaction to OB and talk about the things I got today and how I organized everything. And I'll try to be quick. So, this is because I got to read for tomorrow and pick my husband up and all that stuff tonight. But so yeah, I want to do a little reading so I'll be prepared and know what to expect in class tomorrow. So okay, so this is what I'm going to talk about. All right, first things first. OB is going to be very interesting. I'm very excited. There is a lot of information. Like when I was reading last night, I was like really overwhelmed only because there's a lot to assess on a newborn when they're first born. So my plan is to go to the bookstore and get one of those OB nursing notes just so I can stay on track. But one of our assignments were for today to create a cheat sheet. So basically all of the assessments, we have to list our norms and the norm values for the newborn. That way when we're doing our assessment, if there's something abnormal, we know we can tell somebody or do an intervention right then and there. Like for instance, basically in nursing school, like you'll be doing like some things by yourself as you like progress, but like by the fifth semester I'll be like responsible for two patients or a patient. I think two though by that time. So right in this stage, we are allowed to do like suctioning and assessing our patients and notifying, everything that we find like abnormal. We have to tell our instructor, and then we go from there. But I'll let you guys know more about that as I get into it, because I know what to expect kind of because we talked about it today, but at the same time I don't know all the ins and outs yet. So, but yeah, so okay. We talked about clinical. It's gonna exactly be 8 hours. Psych, we get out a little earlier than 3, because depending on if we have a lunch or not, we'll get out about 1:30 or 2. I think she said 1:30 or 2:30, depending on if we have a lunch or not. So, but with OB, we're in there from 7 a.m. to 3 p.m. and it just adds up with the hours that we're supposed to have. And also, they found that when we would leave early, that we missed out on so much of the nursing care. So it works better. Plus, I'm pretty glad because this is the field I want to be in, so I want to see everything. We might have the opportunity to go to the NICU, but we will be able to witness a cesarean, a vaginal delivery. We'll be in the nursery. We'll be with the mom, assessing the mom. Like my clinical instructor said, we'll be with the mom one week or whatever. The next week we'll be with the baby, and then the following week we'll be with mother. We'll have mother and baby. We'll take care of a couplet. That's what they call it. And so yeah, we got to do twice the work when we have both mom and baby. And then but we have the last semester we kind of like switch instructors halfway through and switched units. But this semester we're staying on the same unit, the same instructor from next week starting all the way until finals week. So that's like awesome because once you get used to a certain instructor and you know what they want and you get used to the unit, you know where everything's at, you get comfortable. To be thrown somewhere else, I don't like to float. When I was a nurse aide, I didn't like to float to different halls or areas that I wasn't familiar with, because then I'm back like a fish trying to learn how to swim again, I guess. I don't know. But yeah, so anyways, that's that. Okay, so for my paperwork, we have 5 clinical packets that we have to get a satisfactory on, that are due, and if we don't get a satisfactory on 5, then we fail clinical. And yeah, you don't want to do that. And let's see. We have to attend a childbirth education class, and we have to do a paper on that. We have an ethic presentation due, which is a group project. We have an IPR due, which is an interpersonal recording process, which is due one time on an approved patient, approved by the clinical instructor. So at least you want to do it once. The nursing care plan is due twice on a mother and a baby. Awesome, I just read that. So yeah, the nursing care plan is this here, old fashioned. Um, so yeah, in the first video that I did, I actually went through and explained it and some of the paperwork because, yeah. So okay, so I'll do that too. So okay, so I told you. Oh, we have an assignment also. When you're on the unit, a lot of nurses have a brain, what they call their brain, which is a cheat sheet of like different things they have to fill in, like things to make sure they get like about their patient. Like I know in med surg they had the lab values on there, they had the vitals, they had any procedures, treatments, um, any type of anything. Basically, it was all like pre-printed on this sheet, so that way they would fill in about their patient, like the birth date, medical record number, everything. And then you just, when you go in, you fill it out, you get report. There's a place where you write your notes for report, and then you just make notes on it. And when you go in and assess your patient, and you get your information from the patient or from charts or the computer system, and you can also document on there, what you did, what time you did it, what medicines you gave. So when you chart at the end of the shift or in the middle or however you choose to chart, you have all your information there, and you don't have to go off of memory. And so that's basically what our assignment is. We have to do a cheat sheet for a newborn and a mother, and then we have to write a narrative note describing our assessment, and we have to pick something wrong with our newborn or mother, and we have to document our finding, our interventions that we do, and our expected outcomes for both. So that's due like Tuesday. Then this is our process recording, interpersonal recording that we have to fill out. It's pretty easy. We did it in the beginning of nursing 110. That's what we call it. That's our foundations course. So basically what you do is you write, I think this one, okay, you have to write 4 verbatim interactions, and they have to show therapeutic communication, and it has certain ways for you to do it, outline it. Let's see. So yeah, we got to do that again, which they're easy, but it just takes time, and you really just, yeah, nobody wants to spend time doing, I mean, it's therapeutic communication. It helps and it works, especially, when you have a patient that doesn't really want to open up or feel strongly about something. It basically gives you a way or shows you a way to get patients to open up to you and talk, so you can develop that trust between them, so you can get information to help them. And also, it doesn't, you don't find yourself in awkward situations like, dang, I wish I wouldn't have said that, even though you probably will still find yourself in those situations. But, with therapeutic communication, it kind of like, it helps you out a little bit. I showed you guys the care plan. When I fill this out, I'll do a video on how to do it. In the first attempt that I made to do this video, I actually went through and like gave an example. But it's been a while since I did this in this way. It's the same thing as I've done before, but just a little different. But yeah. So basically, I'll just tell you the categories. So you put your assessment data here. Normally it should be your abnormals. That's what I was told when I was in 110. 110? I think it was 110. Yeah, 110. And then here you put let's see, your priority, or I'm sorry, your patient or nursing diagnosis and problems. So you put that here. Any issues, high blood pressure, pain, bun levels high or anything like that, or creatinine, anything that is abnormal, you put here. Yeah, I think. Oh, sorry. You put your nursing diagnosis there. So like, you could put like, I don't know, at risk for whatever. So yeah, you put your diagnosis here. I'll go back through it because I have to refresh myself on how to do this. Because I still have my 110 binder and my clinical stuff, so I have to go back through and just make sure I'm right. So, and I'll do a video on it, like just when I do this for my mother-baby patient. And then the goals and outcome criteria, you'll put your goal is like the patient will blah 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 as evidence, or in this time as evidenced by, and then you'll put the outcome criteria for them to meet that goal. Then your planning is your interventions. You got to include rationales, and you got to say whether it's an assessment, treatment, or teaching. And then your evaluation is you go back in, you evaluate what your original issues were, and to see and write down if you want to continue, modify, or discontinue this care plan. So I have to do 2 of these. It's not that hard. It's time consuming, but it's not hard because you'll get your information. You look up your nursing diagnosis, and I wish, you know what? I'll pull one out because I don't like to mislead people. So I'll pull that out and I'll do like, I can't stop this. If I was on my what's it called? Not my webcam. My video recorder, I'll be able to like pause it and go get it real quick and come back and it'll flow. But on YouTube, I can't do that. So anyways, not on YouTube, but on this webcam, I can't do that. So this is our care map here. This is what I'm used to doing from last semester. This is most recent in my brain. You put your patient's initials, their age, your gender, their primary diagnosis, omitting diagnosis if it was different, newborn information, age, sex, weight, and gestation. You'll put their prenatal, labor, and birth story as described in the chart or according to the patient and family. And then you'll put the etiology and a pathophysiology of complications during pregnancy and or labor and birth if present. Then you will write down the pertinent lab values for the baby and the mom. And then we have medications, at least 5. I think you only put 5, but they have to be the most important ones that are prescribed to the patient or the baby. And but mostly be like the mother, but it could be the baby too. So this is our list of medications that we'll most likely see in OB. There are 37 of them, and what we did was we divided them up between the clinical groups. Each one of us will look up the information needed to go on our care map, send it to each other. That way, when we do our care map, we don't spend, an hour looking up all the information to this, to our drugs. So we got to have the name, the generic, and the brand name. We got to have the classifications, pharmacology, I can't say it, the pharmacology classification, and therapeutic classification, the action, the purpose, the patient education, the major side effects, and indications for safe administration, and pregnancy and lactation rating. So you gotta do that for each one, and you do that 5 times. And then at the end, you'll put allergies, like to watch for, possible drug interactions, medical plan of care, because you got to, in order to have a nursing plan of care, you got to know what the doctors, what they want to do, how they plan on, taking care of this patient. Then you can do what you can do, or what, the nursing part of it. Then you have to fill out histories, complications, risks, psychosocial, spiritual, cultural, patient education, outcomes, and reflection, which is on this page. Shouldn't be too bad. Like I said, it's not hard. It's just time consuming. It takes a while to do it. And then this is your reflection and your observations. What you learn, what you expect. Then this is the old-fashioned map here. And what you do is, like, all your assessment data that is abnormal, you'll put it in these boxes. And these boxes are like sensory perception, nutrition, fluid gas, transport, psychosocial, cultural, elimination, things like that. cram, all of that is in these boxes. So you put in your abnormals, and then you put in 3 nursing priorities. On the flip side, you'll put your interventions for priority 1, 2, and 3, and then you'll write your expected outcomes. You'll describe how one of the priority nursing issues may affect one or more of the body systems. And choose 2 potential complications for this patient and describe what nursing interventions may decrease or prevent the complication. So, and then on the back you have to write a written narrative assessment of your patient, both on the mom and the baby. And you have to do 5 of those, I believe. Yeah. So, but you do 1 when you have the mother, 1 when you have the baby. You do 2 if you have, well, when you do this, you do, my clinical instructors is counting the mom, baby. You have to do for both, but it's counted as 3 and 4. And then the 5th one, I don't know, I guess whatever you have. But, if you do 4 good ones, you don't have to do a 5th one. So, I'm aiming for 4, and that's it. So, that's that. Yeah, so when you witness a labor and delivery birth, or labor and birth vaginal clinical experience, you gotta fill out the same thing all over again. Kind of. It's different. It's a lot of different questions. A lot of different questions. You gotta just pay attention. Medications, you gotta write those down. Same thing, the web. Yep, the narrative format, everything, just as if you were on the floor. Same thing for this here, for the cesarean section, labor and birth C-section, and a lot of paperwork. But as a nurse, I guess we got to get used to it, right? And I like writing, but just not this much. Okay, so these were our lecture notes today. We talked about the transition period. One thing about, I don't mean to like lecture on OB or nothing like that, or go over, but I find that when I do talk about what I learned, that it actually sticks up here better and I understand it. But I'm not going to do that, like take up 30 minutes just talking about this stuff so I can learn. I'll do that to my husband so that way I can bug him. Anyways, what's really important in a newborn is their vitals. You really got to pay attention to it, like their respirations, their temperature, and respirations, temperature. There's one more thing I can't think of. Not their BP, their heart sounds is also important. And you have to listen to their heart rate and their respirations for 1 full minute, because babies, their respirations fluctuate. 1 minute they'll be like breathing real slow, next minute they'll be kind of pick up their respirations, then they'll stop breathing, and if it's greater than 15 seconds, that's when you have to like notify the physician, because further evaluation to be, well, in my case I'll notify my clinical instructor. And then the heart, there's 3 ducts that have to close, and so you got to listen for a full minute, and their heartbeats are fast, so you have to really listen. But yeah, we learned how to do our assessments over everything and how much they should eat. And so we talked about circumcision and jaundice. And yeah. And that was all we talked about. So it was interesting. This video is already 19 minutes. So what I'll do is I'll upload this video, and if you care to watch, I'll show you one of my care plans from last semester. I'll just tell you like what goes in it, and I'll give the example, but not too much information, because I don't know if you notice, there's a lot of things in the media that are actually happening, or in articles or whatever, that a lot of nurses and nursing students are providing too much information to social outlets such as Facebook, like posting pictures, saying enough information about a patient's condition for somebody else to identify them. There's so many HIPAA violations, and if you're a nursing student and you violate HIPAA, you can lose your position in the program. So yeah, I don't want to lose my position in this program, but I'm not going to. So I won't give like real specifics, but I'll give you like an example, like one example or something, like something very like broad, like not even identifying at all. And yeah, and if you're a nursing student, be careful about HIPAA. It's very serious, and you don't want to lose your position in a or your seat, your spot in a program because of HIPAA. Just zip it up. Don't talk about your patients to anybody. Don't put stuff on Facebook. I know I am on Facebook all the time and I update my status regularly, but don't put stuff about your patients on there. If you had a really cool clinical experience, just say that. Don't give any information about your patients. But yeah, so anyways, I will do that video. Good luck to everybody in nursing school this semester, and that will be in future semesters. And yeah, let's rock this semester out, guys. Alright, I'll see you guys in a few seconds.